Hi YouTube, so this is Candace and I'm with Counseling minus the Bull. Today's topic we're going to do premenstrual dysphoric disorder. Fancy terms. So the actual terms is PMSing as a woman, and we're going through our cycle every month, once a month, and we actually have a disorder. And this is basically can be applied to any woman that's going through their menstrual cycle. And a lot of people are not aware of this disorder as well. So we're hearing jokes about, oh, you're on your period or you're just PMSing. And we hear that on a daily basis as a woman, if we may have an attitude or anything like that, especially as the stereotype, the angry Black woman. We hear that quite often as well. So what I want to do is just make awareness about this disorder, and let's go from there. So premenstrual dysphoric disorder, or just simply PMSing, it is a disorder. I'm sorry, I'm using my DSM-5. Actually, I have it right here in hand. So it is, in majority of your menstrual cycles, at least 5 symptoms must be present in the final week before the onset of menses. Start to improve within a few days after the onset of menses and become minimum or absent in the week post menses. So you have to have one of the following symptoms present, which is marked affective liability, which means mood swings, feeling suddenly sad, tearful, increased sensitivity to rejection. You have to have marked irritability or anger, marked depressed mood. You have to have marked anxiety, tension, feelings of being keyed up or on edge. So you have to have one of those symptoms, I should say. And then we also have to have C, which is one of the following symptoms must be also present to reach the 5 symptoms that's needed. So number 1 is a decreased interest in usual activities, is difficulty concentrating, having lack of energy, having a change in appetite. So either you're overeating or you're having cravings for certain foods, insomnia or hyposomnia. So you're having problems staying asleep or going to sleep, a sense of being overwhelmed or out of control, and physical symptoms such as breast tenderness, swelling, joint or muscle pain, a sensation of bloating or weight gain. So all of these symptoms must be met. Remember, it's out of 5, and you have 3 different categories, A, B, and C, that has to be met as well. So you have at least 1 out of B and C, and then A has to be met to have it. And then lastly, D, the symptoms is not associated with significant distress or interference with school, work, or family, social activities. There's no disturbance of symptoms from another disorder or substance or alcohol. And then symptoms are not due to a medical condition. I'm missing what I'm reading. I'm sorry. It should be confirmed by prospective daily ratings during at least. Yes. So that is the symptoms of it, and that is the definition of premenstrual dysphoric disorder. And we're just going to call it PMSing as a woman. So I just wanted to kind of make this video an awareness video. Like I said, we're usually stereotyped as the angry Black woman, and we have this known attitude or so. But what I can say, I'm not making this video to kind of justify that. That's not what I'm doing. But I also want to make this video to have some type of awareness that this is a disorder. A lot of people are not aware of it. And this disorder can kind of fit every single woman during their menstrual cycle. So yeah, just bringing awareness to this, as well as allowing you to be self-aware of yourself during this time. A lot of women have other things going on medically, so this cannot be due to like endometriosis or anything of that nature. This is due just to your menstrual cycle. And this can be, well, some of the symptoms, as you can see, can mimic other disorders. So depressive symptoms are included, as far as your mood swings, and as far as, um, yeah, feeling angry, concentrating. So there are symptoms that will fit other categories. But what you're trying to do when you're doing diagnosis is to match as many criteria needed to make a diagnosis for this specific disorder. So what can we do as a woman with the premenstrual dysphoric disorder? So we have a lot of things over the counter. We have like medications. A lot of women have nausea, vomiting, things of that nature. So you have medications you can take for it. You can heating pads. You can relax and get some rest, because additionally with the insomnia or hyperinsomnia, you're just tired. You have that lack of energy, and that's normal. It's normal, but it's also a symptom of the disorder. So yeah, just getting some rest, taking your medication, specifically maybe pampering or something is good for women in their menstrual cycle. Continuing your activities. I know it's not easy to want to get up and exercise or to be active, but we all know we have obligations that we must fulfill, whether we are on our menstrual cycle or not. We are still expected to perform as usual and as scheduled. So you still have to get up, you still have to go to work, you still have to take care of your kids, you still have to take them to school, be in your relationships, and just utilizing communication, how you feeling, utilizing social skills, and just being aware of yourself while you're on your cycle. So this is a very short video. Oh yeah, also use your relaxation techniques. We talked about that in the other video, I believe, for depression. So it's stressing your muscles, using a stress ball to kind of help with maybe some pain relief or stress, stretching, deep breathing, just several other techniques we talked about in the video can be applied as well. And of course, CBT, I suggest that for because it's very universal for different disorders. So just challenging your thoughts and your beliefs about things, and just making sure that rational, making sure you're using alternative and healthy ways to handle situations. So overeating, due to your change in appetite, if you can just encourage healthy snacks, or if you can, yeah, just really deny some of your cravings that it was mentioned here. My hand is really shaking. I just continue to move. I'm sorry, guys. So yeah, so there's just some quick tips, and then also just awareness that this is a disorder. And that is all. I'm going to wrap up here. Thank you guys for watching, and I'll be back soon with the next video. Thank you, and see you next time. Please feel free to like, share, and subscribe, and comments, but please be vague in your comments, be respectful of others, and please respect confidentiality. Thank you. See you next time. Bye.